Hello, my name is Janet Benedict, and I am a doctorate of nursing practice student at Colorado Mesa University. The following presentation is meant to illuminate why stress management is a key health promotion disease prevention topic. The things that cause one person stress may not cause another person stress. Sometimes stress surprises us, and other times we anticipate it, which is stressful in and of itself. Like the stress that I feel when I anticipate having to do a presentation in front of the class. At any rate, no matter what the cause of the stress, if it's not managed adequately, then it can have negative effects, widespread effects that can affect individuals, families, communities, and society as a whole. So, before I start describing specific interventions, I want to tell you about what happens physiologically when a person experiences chronic stress. You see, stress was never meant to be experienced long term. The fight or flight response was only meant to last for a very short time and for survival purposes only. But many of us are very busy, and we have somehow managed to make this response last much longer than it was ever meant to. When this happens, we set into motion the stress response cascade, which is very complicated, but essentially it disrupts the immune system or the immune system's response, which is then expressed with illness. Many people with chronic stress have depression, ulcers, colitis, heart disease, and PTSD, diabetes. Chronic stress has been known to exacerbate many pathogenic diseases such as HIV, Raynaud's, inflammatory diseases, cardiovascular diseases, diabetes, obesity, cancer and metastasis, smoking, psoriasis, and it can impair skin healing. So I had to include this visual, but I don't think you really want me to take a lot of time to go into a lot of detail about it right now. I can show it to you later if you wish and talk about it in more detail. It basically illustrates the biological pathways of the stress biology disease model, depicting how the body attempts to save us from our stress levels. It actually increases our risk for a disease by doing that if it's allowed to be sustained. Studies are showing that mindfulness based interventions for stress actually can have a direct impact on biologic disease. And they're calling this the stress buffering hypothesis. The intervention for mindfulness based stress reduction is one that everybody has seen everywhere, I'm sure. It's very, very common, and it's the most utilized intervention for stress management in all of the literature. Originally, when I started putting this presentation together, I contemplated telling you why stress is important for health promotion and disease prevention, and then to go into many of the different techniques for individuals. But then I realized that stress management needs to be addressed on multiple levels. The stress diathesis model is seen from an ecological perspective, recognizes that health is influenced by many factors in a person's immediate as well as external environment. Studies show that a person's current health status is a reflection of physiological responses to past experiences. I was fascinated with this statement, which essentially means that your body cannot maintain homeostasis if the stress never turns off. your body will just keep releasing hormones, which decrease immune response and eventually impairs your health. So, as I said before, stress was meant to be temporary. So, utilizing the ecological framework, the strategies for stress management can be designed for both individual and aggregate populations, and ideally will incorporate both to be the most effective. The ecological framework would have interventions aimed at all levels, recognizing the interactions and influences between them. The levels of the framework are individual, interpersonal, organizational, and policy. I found several excellent and interesting studies to show you which demonstrate much of what I've been discussing so far. The first one is one that most of us can relate to as we all began our career as nursing students. I'm sure you remember that. The study is called NURSE. N is for nurture the nurse, U is for use resources, R is for foster resilience, S is for stress, E is for environmental management. And these will become clearer in a few minutes. This study is based on Watson's theory of human caring and grounded in the philosophical view of holism. Many of the stress management techniques with the nurse intervention were used by Watson in her examples of strategies to help nurses shift to a caring, healing consciousness. Caring for self and others is a core concept of this theory. The theory the design is a sequential explanatory mixed methods design with a quantitative phase and a qualitative phase. The aim of the study is to test the feasibility of incorporating stress reduction model into the nursing curriculum. The nurse model includes intervention strategies related to time management, cognitive reappraisal, coping with stress, effective communication, and the utilization of simulation labs to reinforce the concepts presented. Creating caring occasions is a concept developed by Watson because she was of the belief that in order to care for others, you need to care for yourself. And she believed that patients can detect a nurse's attitude and stress level, which affects the healing process. Watson encouraged both nursing students and nurses to practice this model in stressful situations, which means pausing to use simple techniques such as centering, breathing, and mindfulness to create caring occasions for self, which then could change the presence of the nurse, affecting the whole energy field and provide a sense of renewal or a shift to a caring, healing consciousness. We all know how stressful nursing school can be, but studies have shown that it can have negative effects on health. Some students get poor grades and some just drop out because of stress. This has the potential to affect the whole nursing profession and society by influencing the future of healthcare. We need to try to keep nurses in the profession, both the students and the RNs who are already working, and becoming burnout and then leaving the profession. So the first phase of the nurse intervention are based on the nurture the nurse, using resources, and the resilience. And these help to outline the skills that are used. And they are how to take better care of yourself, developing awareness of stress, using positive affirmations, using academic and personal resources, building resilience, managing time, and then that is followed by role play in the simulation lab to reinforce the concepts. The second phase of the nurse intervention is designed around stress management and environmental management. The skills taught are stress management techniques, deep breathing, music is incorporated along with imagery, and some yoga. The second phase includes skills for effective communication, which is very important to navigate the healthcare environment, as we all know. This is followed by role play, again, to reinforce the concepts presented. The results of the study show that it definitely is highly feasible that this could be incorporated into the nursing curriculum, but more testing is needed. So in this slide I've listed all of the psychometric instruments that the researchers used to measure the variables in the nurse intervention study. Some of them are more statistically reliable than others, but the researchers made every attempt to conduct a controlled study. I believe that this intervention touches on many aspects of the ecological framework, and it appears as if it may be a valuable intervention for inserting into a nursing curriculum because it has the potential to have far-reaching effects. So for a more client-focused intervention, resilience training is something that was used in a study done by Unger et al., cited by Chandler, Roberts, and Chiado. Unger's study was to test resilience training in adverse childhood events, utilizing the ecological framework again. Remember, the ecological framework is based on the concept that individuals and their environments interact and influence each other. Studies demonstrate that if an individual is successful at navigating their social, relational, and physical environmental resources, they build resiliency, which in turn leads to successful stress management. This reminds me of the student nurses learning to navigate their environments. Very similar concept. Resilience training from an ecological perspective, the individual level includes mindfulness-based stress reduction and meditation for stress buffering. Remember the stress buffering hypothesis? Some of the other individual level strategies are journaling, education, affirmation, positive affirmations, challenging cognitive distortion, centering, breathing exercises, awareness of stress, and using resources. Many of these were used in the nurse intervention. And Watson, she was a very wise woman. She says to always remember to hit the pause button. I think I'm going to have to remember that. I have to say this presentation has helped me to decrease my stress levels. So at the intrapersonal level, it looks like intervention or strategies to promote family connectedness, peer support, and supportive relationships. It's important to maintain healthy intrapersonal work relationships, give positive encouragement, and encourage social activities like exercise and yoga. Music would be in this category. spirituality, and at the community level is mentors and increasing protective factors. This last specific intervention that I'm going to talk about touches on many aspects of the ecological framework. It's called behavior parent training. BPT has already been in use to help strengthen parenting skills for parents with children that have behavior problems, such as children with ADHD or attention deficit, have hyperactivity disorder. Studies have demonstrated that this intervention has strong outcomes when it comes to improving ADHD related child behaviors. The only thing is that nobody tested the parents. And parents of children with ADHD have a lot of stress. So the results of the study showed that BPT resulted in actually increased the parenting self-efficacy scores. It decreased parenting stress, and it improves coping skills. And these results were seen regardless of whether there was an improvement in the ADHD symptoms or not. So this study appears to indicate that improving parenting skills helps parents manage stress regardless of whether their children's behavior changes as a result of their new skills. On this slide, I have listed the psychometric instruments that were used by the researchers to measure the variables. As you can see, they're mostly statistically significant. The application of this intervention to clinical practice is significant for designing programs to influence parental skills, decrease parental stress, and increase self-efficacy, along with improving children's behavior. And all of these play a role in improving the community as a whole. This can help design programs for the individual level as well as the aggregate levels. I just wanted to briefly touch on the other levels of the ecological framework as they relate to stress management. Requisite personal holism is on the organization level of interventions, but it certainly touches on other levels. The requisite personal holism is essentially human resources, only I think they're the kind that really help people in the organization by developing many different programs like stress management and diversity management, wellness programs that include nutrition, employee assistance programs, music therapy, and mental health information and assistance. Some community level interventions could look like nutrition programs, spirituality, job training and placement, school programs to increase self-esteem and stress reduction, outreach programs, impact framing, and this term is found on page 140 by Ray Gruber, where pictures are taken in order to illustrate certain concepts. Policy level could look like increased funding for programs and making mental health more accessible. In summary, inadequate stress management can have profound effects, both psychological and physiological, and these can emerge as illness. Stress not only affects the individual, but also families, communities, and society as a whole. The ecological framework appears to prove an excellent model for designing programs to mitigate this problem, as it recognizes the interactions that occur between all of the levels. As you can see, stress management programs can take on many shapes and can be directed towards individual or aggregate populations, but it is always wise to design them with the knowledge that each has an influence on the other. I hope that you have enjoyed this presentation, and I want to thank you for watching.